Dr. John Nkengasong is credited with preparing Africa to tackle the COVID-19 pandemic way back in January, even before it hit the continent.
We knew what to do, but we just didn't have access to diagnostics. So it's like knowing that your enemy is coming and you don't know how to protect yourself. I think that was the most trying moment for me as an individual as a part of doing my job. So as Africa CDC, as I indicated earlier, worked very, very hard to using all kinds of, and in addition to that, in March, where we thought we knew where the diagnostics were, the airspaces were closed. Governments have closed down Europe, shut down, Africa was not moving. So there you are, you now know where you could go get diagnostics, but you couldn't get to where you have to get a diagnostic. So I think it has been that was the most trying moment.
The Africa CDC has since assisted countries across Africa to do their own diagnosis and guided them on what preventive measures to encourage their citizens to apply to prevent COVID-19 transmission.
We kept our position as the least affected continent with COVID-19. The death rate is very low compared even to individual countries. The recovery is very high. The way member states managed to fight this COVID-19 pandemic, the way we managed to bring all of them together and for them to act in unity and together as one continent, not as individual countries. I think this is in itself a success.
But the progress of combating the pandemic is slow. Many African countries have weak health systems. The Africa CDC is also worried that the reopening of economies is leading many to relax measures aimed at preventing the spread of the virus. While the continent has so far confirmed at least 1.4 million COVID-19 positive cases, the Africa CDC is still concerned that the testing capacity remains very low. The continent has so far tested just over 1% of its population of about 1.3 billion people. But the race for a COVID-19 cure is already on, and Africa has positioned itself strategically to benefit from vaccine development being done elsewhere in the world. As co-chair of the Africa CDC Consortium for COVID-19 vaccine trials, Dr. Nkengasong is leading the securement of a variety of late-stage vaccine clinical trials on the continent by working with vaccine developers, funders, and local facilitators.
For us on the continent, because our manufacturing capacity and development capacity for vaccines is limited, we stand at a position that we express optimism that global solidarity and cooperation will prevail over protectionism, because we are in this together. COVID infection anywhere in Africa will continue to be a threat anywhere in the world. I think it has to be very, very clear to everybody. We are in this together for a collective security as people living in the same planet.
Dr. Nkengasong says now is not the time to celebrate because the continent is yet to hit the peak of the pandemic. Coletta Wanjohi for SABC News in Addis Ababa, Ethiopia.